Greetings to everyone. Greetings to everyone. My name is Mike Gomez, and I am a member of the faculty at New York University. And I'm very pleased to serve as the moderator for this panel, a panel entitled COVID-19 in the African Diaspora. We are fortunate to have with us several leading scholars, and I will introduce them in alphabetical order. But first, I want to say that this is a panel that's organized by the Association for the Study of the Worldwide African Diaspora, or ASWAD, of whom I am a member. And so we come to you on May the 15th, 2020, in a most precarious moment of our collective lives. As we speak, the total number of persons who have been affected by COVID-19 around the world is nearly 4,450,000. And of that number, nearly 303,000 people have succumbed to this disease. And we're talking about this situation. We're talking about this exigency because we know that persons of African descent around the world are being disproportionately impacted by this disease. And so we want to come together as an intellectual community and talk about how this set of circumstances is impacting us across the world, around the world. And so for that purpose, we have with us several scholars. I'm going to introduce them in alphabetical order. First, I would like to introduce Professor Luciana Brito, who is an assistant professor in the Department of History at the Universidade Federal do Recôncavo de Bahia in Brazil. She she specializes in the history of slavery and abolition in both the United States and Brazil. And she also works in the areas of race, gender, and class in the Americas. In 2015-16, she was the Andrew W. Mellon Postdoctoral Fellow at City University of New York Graduate Center. Earlier, she was the recipient of a Fulbright Doctoral Fellowship, 2011-2012, during which she spent her time at work at New York University. She is the author of several articles and the book Temores de Africa, or Fears of Africa, which will soon be published in English. She is a member of the Black Women's Network of Bahia, and she is a Black intellectual and working class feminist. So we're happy that she is joining us today. Next, we have Dr. Ugo F, who is an assistant professor at UCLA in the Department of African American Studies. She is a medical anthropologist who works at the intersection of medical anthropology, public health, Black feminism, science, technology, and society studies, STS. Using interdisciplinary approaches, her scholarship focuses on reproductive and sexual health, gender, race, aesthetics, body knowledge, and body modifications. Her book project, The Family Plan, Racial Aesthetics, Sterilization, and Reproductive Fugitivity in Brazil, traces the influence of an economy of race, aesthetics, and sexuality on reproductive and sterilization practices of women in Brazil. She's also working on a play, Securing Ties, which draws heavily on her book project as a means for critical public engagement and an incorporation of the arts in her scholarship. Next, we have Julius Fobil, a professor of environmental health and who is the dean of the School of Public Health at the University of Ghana. He has published widely on urban environmental health in low-income economies, with an emphasis on the impact of sanitation infrastructure, neighborhood environmental conditions, environmental change, and area-based socioeconomic inequalities on human health. More recently, he has focused on building research capacity in environmental and occupational health in West and Central Africa, as well as emergency preparedness and management. Last but not least, we have Dr. Maboula Soumahoro, an activist, writer, and academic involved in issues relating to racism and Black and African culture in France and the broader African diaspora. She is an associate professor in the English department at the University of Tours in France, where she also received her PhD. She's a specialist in the field of Africana studies, and she has conducted research and taught in several universities and prisons in both France and the United States. From 2013 to 2017, Dr. Soumahoro served as a member of the National Committee for the Memory and History of Slavery. And also since 2013, she has served as the president of the Black History Month, BHM, an organization dedicated to the celebration of Black history and cultures throughout the world. Dr. Soumahoro is the author of Le Triangle et l'Hexagone, Reflections sur une identité noire. Black is the Journey, Africana the Name, published by La Découverte in February of 2020. Welcome to all of our panelists. So we would like to begin.
Dr. Dowe has just signed in.
Oh, fantastic, wonderful. We also have joining the panelists, Dr. Nicole Phillip-Dowe, who has served in the field of education for the past 19 years. She is currently the head of the University of the West Indies Open Campus Grenada site. She is a historian, having written and co-authored 4 books, including Women in Grenadian History, 1783 to 1983, Perspectives on the Grenada Revolution, 1979 to 1983, and Caribbean Social Studies Book 2 and 3. She provides community service by giving lectures and talks on history, culture, and other related issues. Welcome to all of the panelists. I'm delighted that you are able to join us. And I want to thank the organizers of this special panel, Doctors Laurie Lambert, Dr. Ben Talton, and of course we want to recognize and honor ASWAD President Robert Trent Vincent. So we want to proceed by engaging with a number of important leading organizing questions. And what I would like to do is to present the question to each of the panelists. I would like for each of the panelists to take a few minutes to respond to the question. And then we will have opportunity to engage one another with sub-questions related to the particular leading question and have a discussion among us. So the first question has to do with the current state of the COVID-19 epidemic as it pertains to to where you are located. And so if you could tell us what's happening in your part of the world at this time with respect to this with respect to this pandemic, And specifically, if you could address what are some of the key or leading pre-existing economic and political dynamics that are impacting the experiencing of this disease in your part of the world. So we can begin with Professor Brito.
Well, hello, everyone. Thank you for this fantastic opportunity to understand the impacts of the pandemic in Black population in the diaspora. Are you guys listening me well?
Yes, we can hear you very well. You're doing very well.
Yes, we can.
Okay, thank you. Well, we can say the scenario that we have of the pandemic in Brazil confirms a lot of the Brazilian racial politics. We are having a lot of problems in knowing the exact numbers of white and Black people infected in Brazil. Like most of you guys know, in Brazil, and most importantly, during this government, that we are losing a lot of the policies for Black population and women's rights that we had before. Not all of them that we demand, but important politics we had before. This government has been adopting the politics of neglecting racial disparities in Brazilian society. And this has been reinforced by the lack of information on Blacks and whites infected and who die in Brazil. So we don't have these numbers. Right now we have in Brazil almost a little bit more than 15,000 people dead. We have over 200,000 people infected. And after a pressure of a Black movement in Brazil, today we know, based on the Ministry of Public Health data, that, let me see, 47% of the people infected in Brazil are white people, 42% are brown people called pardos, which is this category in a lot of things, and only 7% of the people who die of COVID-19 in Brazil are Black. But the important information is 30% of
Okay, I think we've lost Dr. Brito, and perhaps we can come back to her so that she can finish her response. So,
I'm
Dr.
sorry.
Brito, that's okay. It's not your fault. Okay, we're back. Okay, you're back. So continue with your with what you're saying.
Yeah. So when we see the numbers of this lack of notification, the small numbers of Black people, just 7% in the whole country, in the same pattern of information is repeated in São Paulo, which is the center of the pandemic in Brazil. We know that Black people are dying with no notification about the race. We have also the information, the numbers that we have also show that more Black people receive less treatment in the hospitals, less Black people, but the most of the people who die of COVID-19 are Black people. So whites in Brazil have more treatment in the hospitals. And we are in a country that have free public health care. We have a public health care. So these are the numbers that we have. We don't know exactly the numbers of the Blacks and whites who die and who are infected of the disease, but what we know is that more white people are being treated in hospitals, more white people are being cured from the disease, they recover from the disease, But in our opposite side, more Black people die of COVID-19 and receive less treatments from the hospitals. People who don't present symptoms are told at the hospitals to go back home. So this lack of information about race and the public records, there was a lot of our Brazilian, the same old politics of Brazil to avoid to expose the racial disparities and the class disparities, showing the numbers and effective information. So these are the, is the best way I think I can respond to this question.
Dr. Brito, could you repeat your numbers, the statistics that you gave us?
I give the statistics of Brazil in general. I can tell about São Paulo. We have more information about São Paulo because this is the other thing. I think that it is the situation similar to United States. Some states are providing more accurate information about the race than the government, than the federal government. So I will tell you guys briefly the numbers of Brazil and the numbers of São Paulo. So the country don't have exact numbers of the people who are infected, but of the people who die. I don't know if you guys know about the situation in Manaus, the capital of the state of Amazonas. Manaus has a crisis now of the funerary system. Manaus don't have enough coffin to bury people. So these are the numbers of the people who die are more accurate. So these are the numbers. And the Ministry of Public Health says that 40% of the people who die are whites, 42% are pardos or browns, 7% are blacks, and 30% have no information. In the state of São Paulo, the center of the pandemic is, the number of is more, we have more details. The numbers of people who die, 43% are whites, 17% are pardos or brown people, 5% are blacks, and 34% have no notifications. People who are infected in São Paulo, the center of the pandemic in Brazil, 38% are whites, 14% are pardos or brown people, 4% are blacks, and 43% of the people infected in São Paulo have no notification. So that's what the Black movement, several organizations of the Black movement in Brazil are doing, which is demanding the racial records of the victims to be exposed.
Thank you. Thank you very much, Dr. Brito. Okay. Professor Edu.
Hello. I just want to also thank you all for putting this together. This is a great opportunity to just talk about how COVID-19 is affecting the diaspora. So I'm honored to be here. And I'm currently in Calabar in the state of Cross River in Nigeria. And I've been here since, let's see, March 14th, I think. So I kind of got in and everything kind of shut down. And with Nigeria, you have a situation where you have official records and statements, and then you have this kind of doubt about whether that's actually accurate or not. So officially, we're supposed to have about 5,162 cases altogether. With I think 163 new cases since yesterday. And of those, 1,180 have been discharged, and 167, we've had 167 deaths. And some of the places with the most cases are Lagos and Kano, which is in a lot of the northern states actually have really high cases and continue to we see increases there in like the double digits. And then we see increases like 1 or 2 in states like Ogun or Ondo State, which is in the south. Where I am, Cross River is one of the few, I think one of maybe 2 or 3 states in the whole country that hasn't recorded any cases. Whether that's accurate or not, is questionable, again, because who's testing, who's running tests on people, to know who actually does have cases. It's not really clear. And also, I think we have like 23 laboratories in the whole country that have the capacity to test for COVID-19. So you get a case where there have been a couple situations where we've heard of a possible case in Calabar, and they have to take a test and send it to Lagos and see if that's positive or not. And it's been that it's not been positive. But again, you know, in Nigeria, you have this, prior to COVID-19, you have a situation where we're supposed to have high rates of poverty, high rates of unemployment. A lot of people are hustling on a regular basis to make ends meet, to be able to eat that day. And you have quite a bit of mistrust of the government as well, right? So whether it's what the government's doing, whether it's how government is using funds or mishandling funds. So that's the question of how to respond to COVID, whether people have been able to follow those, the kind of recommendations has varied because of these kind of prior situations. Questions around social distancing is laughable. So yeah, if I could say, and I mean, right now, there was a moment where we were on lockdown as a country for about 2 weeks. And of course, it varied by state. I think Lagos, Ogun, and Kanu had like the most severe kind of lockdowns in the state. Here in Cross River, we didn't have any lockdown. We just had a no mask, no movement situation. Schools were closed, churches were shut down, but people were still moving about, living life as usual. And so after those 2 weeks, the government eased up on the lockdown, and we have a curfew from, I believe it's 8 p.m. to 6 a.m. And of course it varies depending on the state. And there have been threats of locking down again because people have not been following the recommendations of social distancing or wearing masks.
And if I may ask just a very brief follow-up question. For example, in the United States where I am now, the entire conversation every day, all day, is dominated by COVID-19 on all of the media. What is it like in Nigeria? I mean, where is this, the premier conversation that you find in the media, as well as, in the street and, with your neighbors and so forth? I mean, is this the principal discussion, or is Nigeria focused on other matters?
No, it's definitely a big conversation point. You turn on the radio, it's COVID-19, interviewing this person, talk about COVID-19. How should we be responding? What's the response to the governor's response? And yeah, you definitely hear it on the streets, in various different kinds of ways. I think in the kind of everyday, there's a way, again, it depends on whether people think COVID-19 is real, whether they think it's in Nigeria. Then I think that depends on how much space it takes up in the conversation. But I think there's also a lot of folks kind of, just got to pray, it's just God. And then they kind of move on in the conversation. So it definitely is taking up space in the kind of public conversations and in the media. Yeah.
Thank you, Professor Edu. Dr. Fobil.
Yes, sir.
Please, the floor is yours.
Okay, thank you. First of all, let me thank you for giving me this opportunity to present the situation in Ghana. But from this previous speaker, as you're all aware, the pandemic hit Africa much later than any part of the world. And in Ghana, the first case was reported I think it was precisely on March 12 or 13, if I'm really correct. And then by March 16, we went into full scale, trying to put in place various measures for its control. As we stand now, we have a total of 5,530 infections, and we have 674 recoveries, and unfortunately, we have a total of 24 deaths. I mean, these are correct. Because it's not a stigmatizing illness, and so these are fair reports. And as an academic, I have no political incentive or political reason to conceal these numbers. So in terms of distribution, there are two epicenters in the country. The capital city, which is Accra, has 4,204 cases. And then the second largest city, which is in the part of the country called, where we term Middle Belt, is in the middle. The country is coastal south, and then the northern Savannah Belt in the north. So then between these two extremes, this the coast and then the Savannah region, you have what we call the middle belt, and that's where Kumasi is. And Kumasi happens to be the second largest city, and it's the infected cases there are 788. So as you all know, this pattern of the pandemic is similar to other parts of the region. As you can see that recovery deaths are much, much lower than infection, so it has high infectivity rate. Recoveries are very low, because out of the 5,530, we have only 674 cases. So let me, I don't know what, I don't want to go into details, but I think because the disease was late, starting in our part of the region, we have learned a lot of, we have learned from, other regions, the experiences from other regions. So we took the measures, we implemented the measures much early within the pandemic. But what has been difficult is that some of the measures that we borrowed from other regions are not working. For example, social distancing. It is inconceivable to say that you want to do social distancing in a marketplace, for example. The other challenge in implementing some of the measures is also, in terms of income inequalities. We have a huge chunk of the population being poor, and so. And although they are working, they are not in regular jobs. So the informal population is very high. So it is inconceivable that if you were implementing a lockdown in our region, people who live from hand to mouth aren't able to go. They aren't going to make it, because you lock them down, and because they have no savings to rely on, they tell you that, well, there is hunger virus. You have coronavirus, but it's also versus hunger virus. People don't want to go down, won't stay at home if they don't have anything to eat. I think so that's the bit of where this has caught up. The politics of the disease comes in. So somehow the government that is leading, the current government that's leading the effort, you have big opposition, also towing the other line, saying that trying to make it. And I think this is unfortunate. As an independent person, I think this is an unfortunate situation. So we always say that, well, and I've seen this also in America and elsewhere, that there should be no politics in this disease. But I can tell you that we can never be able to. We can't say that we cannot take politics totally out of this. So let me give you quickly what I think our strength here has been. And it is that we've done a lot of testing compared to other countries in terms of, like, if you look at US and Germany or European countries and even Southeastern countries, Ghana has been very successful in doing a lot of testing, but I must admit that as an epidemiologist, the testing has its shortcomings. For example, we have delays in testing because when there's a case, we have had aggressive contact tracing resulting in a number of contacts. And so there's always a big pool of individuals to be tested, but we have fewer. Only in the country, we have 2 testing centers until a few weeks ago when we scaled up to maybe, I think now we have up to about 10 testing centers. And so the testing has always lagged behind, the disease. And so if we were even to calculate, estimate the infectivity rate or transmission rate, it's impossible because whilst we know that the disease is rapid in infection, there's delayed in testing. And so you are not able, if you calculate anything, you are not sure whether it is delay in testing or it's actual. So this has to be acknowledged right from the distance. And as an epidemiologist, I also I have requested for some of the data to do modeling to be able to get them this. Up till now, I still don't have the full data. And of course, this is internal politics of the disease. The government people, I'm not sure whether it's intentional or not. I've tried to really investigate this. I still don't have the answers. So I don't want anyone to ask me about, deep politics about the disease. So I think let me end here. And if you have any other questions, I'm happy to take.
Thank you, Professor Fobil. So now we turn to the Caribbean and to Professor Phillip-Dowe. And would like to hear from her with respect to what's happening both in Grenada and the Caribbean.
Hello, good. Well, it's midday in the Caribbean, in the Eastern Caribbean. So warm, sunny greetings from the Caribbean. I can speak on CARICOM nations. There are 14 member states of CARICOM, and they include some of the countries that are not necessarily part of South and Central America. So Guyana is part of that, so is Belize and Suriname. And Haiti is also part, although she would have been a former French colony. As of the 13th of May, our numbers were, based on those 14 countries, 1,273 infected and 69 deaths. The Caribbean has been generally very proactive in terms of dealing with the disease. Proactive from the standpoint of the governments of the region, basically looking on as to what has happened in the wider world and trying as far and as much as possible to have proactive actions in the region. So I can use Grenada as an example. So for example, in Grenada, we have 21 cases as of yesterday, most of which were imported, and there is a possibility of community spread, but limited at the moment. We have no deaths, and 13 persons have been recovered. Just to give an idea of how proactive the government has been, before we had a recorded case, or our first recorded case, the government closed all schools on the 13th of March. What the reason for this was basically enclosed spaces like schools, universities, and so on. The idea was to close them before anything happens. And for us, it was basically that we saw the disease moving from the Northern Caribbean and basically gradually moving south. So a proactive measure was to close schools even before we got to that point. For Grenada as well, St. George's University provides us with at least 20% of our GDP. So another proactive measure was on the part of the university, and they basically closed even before the schools closed, pushed everything basically online. And then the other thing that they did was to get the students out of Grenada. That was quite a task. It was moving like about 2,000 students out of Grenada in the 3rd and the 4th week of March. Again, as a preemptive strike, not wanting to have that many students in Grenada, taking into consideration the fact of how small we are, and taking into fact that our healthcare system was not going to be able to deal with an outbreak with so many people. Throughout the region, generally, the government has been the one taking the lead. We've had quite a number of states of emergency throughout the region. I can't say that we've been very happy about it. We've been very happy about it from the perspective that as Caribbean people, culturally, we like to move around and we like to be outside and we like to lime, as the Caribbean word for it is, and interact, and you know, that's just the way we are. So it has been pretty difficult trying to convince people that they have to stay home. But the truth is, by and large, we have been following the protocols, the social distancing, the wearing of masks, gloves, and so on. We've had some naughty people who have had parties and others that police would have had to shut down. But outside of that, we have been trying as far and as best as possible to deal with to follow the protocols. I think for us, in terms of pre-existing situation, for us, twofold. One, and I'm basically going to look at the economics. For us, we greatly dependent on tourism. That's our reality. And a lockdown means for us that no planes are flying. So it means that we don't have tourists coming from whether it's North America or Europe. And that has severely affected us. So that's one issue. The other issue that is of concern, especially because of where we're heading in terms of the next couple of months, we're very vulnerable to hurricanes and storms. So that looking forward in that hurricane season, we are nervous about the possibility of a hurricane season like 2017, because you're thinking in terms of everyone in the world is in a state of crisis. I think that this has been our greatest crisis since World War II. So it's like everybody's in a state of crisis. So we're just kind of hoping that we don't have to deal with an added crisis of a hurricane or hurricanes in the region at in the next couple of months. But so far, our greatest issue really is our dependence on tourism. And some of the governments have been trying as far as possible to have stimulus packages to help persons. So for example, the taxi driver who doesn't have anybody to take around, or the tour operator, they've been working on that. Grenada, for example, Barbados, for example, they've done some stimulus packages to assist people. So it's basic things like your livelihood that has become a main issue for the Caribbean at the moment. Thanks.
Thank you so much, Dr. Phillip-Dowe. Okay, and so last but not least, we would like to give the floor to Professor Soumahoro. And so she can speak to us about circumstances, certainly in France and beyond if she wishes.
Mm-hmm. So hello again, everyone. Thank you, Laurie and Ben, for the invitation, and thank you, Aswad, for existing. So a few things about France. Right now, as of today, the number of cases, people infected, reaches over 141,000. And out of this number, there have been over 27,000 casualties, so people who have died. But one of the marked differences, but I don't know, maybe we can discuss it later when comparing to other locations, is that in the number of casualties, we really need to pay attention to the number of the elderly who died. So out of the over 27,000 people who died, over 10,000 were people who were staying in retirement homes. So this is one of the issues that has been highlighted by the COVID-19 situation. Of course, we can look at the situation in the general, through our general prisms of race, class, but we need to add age here in this particular moment in France. France has been under lockdown from March 17 to May 11. So since this Monday, past Monday, schools have reopened. Some of the businesses have reopened, but people have been encouraged to work from home when possible, but stores have reopened. Universities and higher education institutions will remain closed until the fall, even though much of the teaching and much of the assessment of students is still taking place online. The academic year is not over, and it won't be over until early July, but students are required to stay home, and faculty as well. I think that when we look at France and in this COVID-19 crisis, we need to look at the health crisis that it has created, and the shortcomings of the management of this health crisis that links the issue to a political issue. So the role of the government, the role of the presidency, the criticisms that have been massive against the government, particularly in terms of the management of the testing, the impossibility to launch global testing, and also the difficulties of spreading or distributing masks. The mask issue has been an issue since the beginning of the crisis. So only this week has widespread distribution of masks truly begun in France. So if the lockdown is over, there are particularities in this end of the lockdown. France is currently divided into two parts. So dividing the country, let's say from north to south, between east and west. And the northeastern part of France is the most infected area of the country, which means that the lockdown is following particular rules in these areas. I'm based in Paris, so I'll talk more about Paris. There is, let's say, less liberty of movement in these particular areas when compared to the northwest, western part of France. I wanted to say a few things about politics and the economy as well. Politics, as I said earlier, heavy criticism in the mismanagement by the government. We need to remember that this pandemic comes in a very specific socio-economic context in France, because you all remember the crisis, the year-long crisis of the Gilets jaunes, the yellow vests, that had just ended, let's say, at the end of 2019. But this movement was immediately followed by massive mobilization and protest against an ongoing reform of retirement and retirement pensions that had been launched by the French government, and that had just begun in, let's say, December, and that continued all the way to February. And among these mobilization, social mobilization against the reform of retirement was the question of the financing of public hospitals. And these, as late as February, there was a strong mobilization among people working in hospitals that was totally unheeded by the government. That officially declared that there was no unlimited funds and that nothing could be done to save the public hospitals. And then we found the hospitals under tremendous pressure in the moment of the crisis of the pandemic. So the president has recently, when I say recently, this morning, recognized the mismanagement of the issues relating to the management and how the public hospitals could be saved, but that was recognized only this morning. In terms of the organization of the end of the lockdown, we also need to keep in mind that the Senate voted against the plan of the end of the lockdown as it was proposed by the government. The Senate only had a symbolical vote, which means that even if they voted no, the government still had the power to implement this plan, but it was still opposed by the upper house of our parliament. A few words about the economy. So a recession has been announced in France a few weeks ago, and I think that the pandemic has created an economic crisis that, of course, will have repercussions long after the end of the pandemic, if we reach the end of the pandemic, which has politically been translated into a temporary reform of let's say, the code of regulations of the workplace, which makes it, let's say, easier for businesses to hire and fire people. And those reforms will run until at least, I mean, at the moment it is December 31st or 2020. So we can only imagine what is going to happen next. So restaurants, for instance, are still closed. Cafes are closed. Movies, movie theaters, and a lot of cultural establishments are closed, and there has been a growing mobilization of people involved in this area, culture in particular, who have called to the government to really look at the situation. Because in terms of, even if we think of the prestigious institutions like the Cannes Film Festival has been canceled, the Tour de France, for those interested in cycling. I would mix culture and sports. The soccer league has been canceled. So a lot of those main events that can be related to sports or culture, but also have an economic impact, are contributing to the fueling of this economic crisis that I've mentioned, and this economic crisis that has also caused the transformation and reform of the work regulations. I want to say a few words about education. Schools have been closed. Universities and higher education institutions have been closed. Primary, secondary, and schools have reopened in Monday, and that has caused a controversy because the vast majority of the French population has wondered the reason behind sending students, younger students, back to school. And one of the criticisms against this decision has been that the younger students needed to be sent back to school so that their parents could go back to work. And the reason why universities have remained, the rationale behind keeping universities closed is that university students were grown old enough to not need parental supervision, right? So even if we, of course, people have worked from a distance from their computers, there are also a number of people who simply cannot work from a distance and who have to go back to work. And I want to say that might be two last points, three maybe. We need to look at hexagonal France, meaning European France, continental France, and what is going on in what is called the overseas departments. Right, so I was interested in hearing the CARICOM numbers that appear to me very low, because in terms of the casualties, when you look at Guyana, French Guyana, Martinique, Guadeloupe, Reunion Island, and Mayotte, there is a number of 175 people who died in those territories. And among those territories, those overseas departments, Mayotte is the only of those territories that is still under lockdown. Mayotte is under lockdown, not partial lockdown like Paris or the north northern part of France is, but on total lockdown. So this is always interesting to see what is going on in metropolitan France and what is going on in other territories of the country. Race, class, and age. I said a few things about the predominance of the elderly who died because of COVID-19, but we don't have the numbers, let's say the racial and ethnic makeup of the casualties in France, as it is illegal. But again, I'll say it is illegal only for hexagonal France. If it was territories such as New Caledonia, for instance, but we don't have those numbers. I didn't get access to those numbers. Ethnic statistics are legal in New Caledonia, but ethnic and racial statistics are illegal within metropolitan France. But if you follow the media coverage and really the public discourse, there has been a lot of attention and negative attention paid to what is called the banlieue or the suburbs in France, which are the territories that where communities of color are most commonly to be found, right? Communities of color and poorer communities are mostly concentrated in those territories. And following the media coverage, these populations of color, those poor populations, were the ones who were not respecting the lockdown, those populations were the ones who were putting France at risk, who simply could not follow the rules. So even though we know that there were not more cases of not respecting the rules of lockdown in those territories, we know that there has been more police attention paid to those territories, more policing in those territories. When, for instance, we would get images and video footage from Paris and people not respecting the lockdown rules, and that was not a police issue, right? And the last thing, maybe a few words about the medical debates that have taken place in France within this period about the use of chloroquine or not, different research groups competing to find the best cure as early as possible. And the, let's say, quite disturbing attention paid to the former empire. That is to say, the attention that France paid, at least in the media, to Africa and what was going on or not going on on the African continent. And this translated into the publication of a number of articles devoted to the imminent crisis. What is going to happen? Is something going to happen? Should something happen? Do we want something to happen to the African continent? And why has the catastrophe not hit the continent? There have been discussions around this. So this, I think this is what I can say about what is going on in France right now.
Thank you so much, Dr. Soumahoro. That was an excellent presentation. So we need to be cognizant of the time. If it's okay with the panelists, I think that we would like to extend this discussion for another 25 minutes or so. And it may very well be that we'll need to have a part 2 because all of this has been prefatory. We haven't really gotten into, the meat of the matter, if you will. But so we'll progress and do the best that we can. I want to ask Professor Soumahoro about the broader situation in Europe, and given the difficulty that you have with accessing data in continental France as it pertains to race, I'm just curious about how does it feel in France? I mean, what is it, what is the conversation in the communities? How are people processing it? How does it, does the pandemic have does it feel like it is impacting African descended communities in a disproportionate way? What's the conversation? Understanding that you don't have the statistics, because from what we know, for example, in the UK, it does appear to be disproportionately impacting African descendant populations.
Yes.
Very similar to what's happening in the United States. So how would you respond to that with respect to France?
I think that France, as usual, is paying a lot of, let's say, media attention to what is going on to both the UK and the United States. And they are able to say, I mean, I'm talking about the mainstream media and mainstream politics. They are able to say that there is a disproportionate number of populations of color dying because of the pandemic. In France, and I'm talking about hexagonal France, this will never be stated that way. Even though within hexagonal France, the department called La Seine-Saint-Denis, which is one of the suburbs of the greater Paris area, is one of the most impacted departments, districts. And La Seine-Saint-Denis is well known for being an area of concentration of, let's say, immigrant populations, their descendants, and populations of color in general. So people will talk about class and say, this is a poor department, but this poor department happens to be a department of color, but it will not be stated. So people will be able to say, a lot of poor people are dying, but they will never say that the poor are populations of color. When you also look at the staff working in those retirement homes, it's interesting to see that every time you see faces on TV or people who died, let's say on duty, who were nurses or people who were assistants to the elderly, or even the staff, the security people guarding stores, for instance. Every time you see their faces and every time you hear their names, there's always this racialized aspect, always. But it's not stated. But it can be, it's obvious when you look at people or when you hear their name. But it's not how it is analyzed. Still not.
Mm-hmm. And your response, Professor Soumahoro, with respect to kind of France's slow response to the pandemic, with respect to testing and protective equipment and so forth, it seems to parallel what has happened here in the United States, what I'm hearing out of Brazil. What's the explanation for France's slow response?
It's France has looked a lot at Germany. Germany has been held as the model, and Germany did everything right. What the slow response is actually due to structural issues that take us back to at least 15 years ago. It really has been the liberal management of all the public institutions that have led to for instance, the destruction, because it appeared on the news. There was a stock of masks that dated back to, I think, 2005 or 2006, that had been unused at the period of SRAS, for instance, the SRAS epidemic. I can't remember the name in English. And at the time, one of the secretaries had been mocked because she had ordered too many masks. And since then, the mask had remained, and the entire stock has just been destroyed because the masks had expired, but also the agency managing the potential pandemics has been dismantled. It has been dismantled because it wasn't useful 15 years ago. And right now, everything has to be built again, but France was not prepared for that. And I think it ties into all the restructuring of all public institutions. I mean, this is the neoliberalism management that we all know of. Less investment in public health, less public investment in anything public. And when a major crisis happens, then we have to rebuild everything, or to reinvest what had been neglected. So I think this is what happens this has been a mystery. The mask issue has been a mystery since the beginning of the pandemic. There has been no, let's say, logical response given by the government. And to this day, only today are the masks being distributed. But there was a shortage. Private companies had to be, let's say, mobilized to produce masks to help the government, right? So,
well, one of the patterns that's emerging here, at least insofar as I can determine it, is one in which countries, societies that are governed by African descendant people, kind of independently Black countries, relative to the rest of the world, seem to be doing okay. And I say that, I mean, that's, you know, I say that with, you know, understanding that we're far away from the end of this pandemic. But relative to the rest of the world, African countries, with the exception of Egypt, South Africa, are not doing too badly with respect to numbers of people who are infected with the virus, as well as mortality rates. In contrast, countries like the United States, Brazil, the UK, more than likely France, and so forth, are countries in which the Black populations are being disproportionately impacted. So we don't know if there will be, if this pattern will change in the future. We don't know that, you know, whether Africa will continue to do relatively well, and I put that in quotes, I understand that. But given that that's the pattern at this point, what lessons can we draw from these circumstances? What is this telling us? I mean, obviously, we understand that these are highly vulnerable populations, and with respect to health profiles, with respect to being essential workers in these various capacities. And so we as a community, or a series of communities, are really quite exposed to this virus and highly vulnerable. But are there other lessons, are there other insights that we can draw from these collective experiences that you would like to comment on?
if I may.
Is this a general question, or it's to a specific person?
Please, Professor Fobil, go ahead, proceed. No, it's a general question to anyone who would like to respond.
Okay, so I want to focus on something very special that is dear to me, and also because coming from biomedical standpoint. So this is a virus, and a virus, I mean, I want to find out I want to ask a rhetorical question, whether we can legitimately introduce race into the conversation of pandemic. I think the right answer is no. In Africa, on the African continent, you see the many countries that we have in terms of like infectivity rates in terms of like mortality and also even recoveries. If you like, I don't think it kills because of any color, no. So yes, in Europe and in North America is where you have people of color and other races coexisting. There might be other reasons to hinge on if we are talking about the way people are dying, the mortality and this, and I think it's more like in terms of physiological conditions rather than color. If you look at in Italy, many people died. They killed a lot of people, probably because in Europe there's a lot of like smoking rate is so high. In Africa, on the African continent, there's not too much smoking as like amongst certain population like Europeans that live here. And in Ghana, I'll give you the Ghana specific case. I just gave global numbers. But if we were to look at many of these cases were imported, and it doesn't only, it's quite deceptive to say that in Ghana we have this because we have different races in there, because there are Europeans here, people who come from Europe, people who come from North America and other countries, and who get the disease and they come to die here. They are far too many more than like those that we have community infections and who succumb to the disease. So the question we need to ask is whether we can really introduce race as a factor in how the pandemic, progresses. That's the question. And I would say the true answer is no.
Thank you, Dr. Phillip.
Yeah. Okay. Go ahead.
Yes, Dr. Soumahoro.
Okay, just to answer this, the conversation that has just begun. I think that to me, I would answer the exact opposite. But my answer is based on where you find yourself in the world. So I think that I understand perhaps non-importance of racial dynamics that you mentioned on the African continent, but even when not talking about race, you could be talking about nationality. When you said that cases were imported, where people were coming from when they imported this, like the virus on the continent. So I think that whether one talk about nationality, ethnicity, or race, these are elements that would be that are structural in particular in particular societies. And if we think of the Western world, the way race operates is not that because you're Black or you're white or you're Asian, you're going to contract the virus or you're going to be, no, it's race is let's say almost constructed socially and then anchored in your body, which would mean that the people that would be the most exposed or the most vulnerable or with the least access to the treatment will be the negatively racialized population. So in that, race matters and structures the whole pandemic. That's the way I view it. Race is structural. If the poor, the poor will be the populations of color. And it can be of color or it can be of ethnicity or nationality. It doesn't matter. It doesn't matter.
Thank you. I think Professor Edu wanted to respond, and then Professor Brito.
Yeah, thank you. I agree. I think that we can't take the question of race out of this. I mean, I think even the ease with which the COVID-19 has been imported into African countries and the way that people who can get visas and come into the country at will is a conversation about race, right? We can't take that out. This question of colonialism. I think even as our colleague was talking about the French and how they're thinking about Africa, how Africa is being imagined, and even the shock that Africa hasn't blown up in terms of the crisis and the kind of questioning. I mean, it happened in the US. Why aren't Black people dying? And then all of a sudden, we started looking at the numbers and, oh, okay, wait, Black people are dying. Everything is good in the world then. And I think this kind of questioning and looking for and wondering why not, and picking out why Africa hasn't become the cesspool of disease as the kind of narrative and construction of it has been, I think we should pay attention to that. And I think because of on an everyday basis, yeah, it may not be a question of race, but the question of ethnicity. I know here in Cross River, there's ways that people talk about people in the North and the way that they do things. And recently, our borders are supposed to be closed, interstate borders. And there's a truckload that came down, it had cows in it. And when they opened it, they found out there were people in there that don't have any luggage, they don't have any belongings, they're just there. And they asked them, where are you going? They said, we're going to Cross River. What are you coming here for? And they didn't have any answer, right? So this question around ethnic, how can I call it? Ethnic strife or ethnic conflicts. But again, the way that African countries are positioned and the neglect that we experience, I don't think that we can take out of a conversation of race, right? The resources that our government and our leaders have squandered and banked in the US, in Europe, in European banks, like I don't think we can take that out of this equation. And I definitely think it's a question of race. And I think it looks different on the everyday in African countries. But I definitely think that if we ignore the question of race, we're setting ourselves up for an interesting situation, especially because people are really projecting and hoping and kind of planning for Africa to hold the disease in particular kinds of ways.
Thank you.
Okay.
Before you respond, Dr. Fobil, Dr. Brito wanted to respond.
Okay.
To add,
did you want to respond to
my
the
perspectives to this?
Dr. Brito, did you want to respond to this?
Yes.
Okay.
About how race in this analysis on the pandemic that we are doing. In the beginning of the pandemic in Brazil, we had understanding that the COVID-19 brought by elite people. So in most of these people had a connection with Europe. The first case of COVID in Brazil came from a middle-aged white entrepreneur who came from Italy and gave to Black people, to poor Black people, and initially that this disease would be to white people. In the beginning of the pandemic, when most of the people who presented the virus were people from the elites who travel to Italy and the United States, was a guy who came from the United States was the second case in my state, in Bahia. Was a really fancy wedding party. He just came from the United States, one of the people engaged in the party. And he spread the disease among the virus among a lot of the people in this wedding party. So this was the first impression of the virus, or this is a virus that will be confined among the elites. So because in Brazil, it's impossible to don't talk about race and class. So the second stage of the virus was to see Black were contracting the disease because of the people the domestic workers, primarily, who were people who were taking care of the people who got the virus. So the domestic workers makes me have a lot of the connections with the reality in France. So the people who were taking care of the people who got sick, initially the white elite who came from Europe and the United States were Black people. So the second of the virus was to see these Black employees, domestic workers, doormen, delivery people, people who needed who were working, taking care of this white family, and people who use the public transportation being infected. Then the second stage was this. We have the first case in Bahia, for example, was this, the second case was this white woman came from Italy. Then she was isolated in her house. The only person she had the contact was the domestic worker, a Black woman who was taking care. And this domestic worker passed the virus to her mother and her husband. So was the whole in her community, in her house, who were served by the doctors. So in Brazil, was really quick to see how rated to class by, in the first moment, I'm calling the first moment, being a virus confined to the white elite. Second moment, the workers, and then the families. Then we can see, because of the pandemic, a health crisis, and a political crisis at the same time, we see in the first moment the government, the thing that is more similar to Trump, which is our president, first neglecting the disease, then giving letting the governors and the mayors take implement the protocols in the cities and the state, and the federal government implementing policies that reject the gravity of the pandemic. So this month, when the pandemic was already spread communities, and what we are seeing, the media confirming these numbers that I told you guys, more Black people are dying, suspected, affected, the more Black people have access of health care. The government said that this month, when the numbers were increasing really fast in Brazil, so the president said, so what? I cannot do miracles. And he has been defending this policy of, we cannot about this pandemic. Some people will die. Now at this moment, that is clear for us that is affecting the Black and poor populations in disproportional numbers. So again, I'm here analyzing how race and class are connected in Brazil. And I think that the case of a young entrepreneur in Brazil, a white guy who owns a company, summarizes this idea of how race and class are the methodology of, the elites think what we are showing to the necropolitics of the measurements of have been used in Brazil. Anyways, this owner of an investment company said, is a young man, a young white man, that summarizes this idea. He said, the pandemic is under control in Brazil. We are doing very well. I'm saying we, the medium class, and the elites. Our problem now, the challenge of Brazil are the poor people, people who live in the favelas. That's why we are not doing even better. So the idea for the Brazilian elite, include our president, is that the problem is over. What is the main concern about is to have take advantage of this moment to implement work policies that make the workforce even more vulnerable, and invest in policies to support Black people like we now is a waste of money, is a waste of public money, right? Like they are refusing to give financial support of this, a lot of it then unemployed at this point. So in the case of Brazil, it's impossible if we think at the beginning of the pandemic, they came to Brazil through the bodies of this white elite, that for them now, the problem is over. At this point that we are now, the people who are now more vulnerable are the poor and Blacks is evident to me in the case of a Brazilian reality, how race and class are connected, are making just deeper. The pandemic is just making the inequalities that we already have.
Thank you, Professor Brito. Now, we are at the end of our time. Dr. Fobil wanted to respond, and I want to give him an opportunity to say something very briefly before we end.
All right, thank you, Dr. Gomez. Yeah, so it's more like a clarification, because if when I said race as in like, if we're looking at whether you are Black or white or not, is that a factor as to how you go down with the disease? That's the question that I was saying. But of course, I'm seeing that my colleagues are thinking about race in a broader context in terms of socioeconomics. That makes a difference, because I think that if you put a white man here and you put a Black man here, equally fit. What I mean is, like, from biomedical standpoint, that these are healthy white. This is a healthy white man and a healthy Black person. Whether if you put coronavirus in the environment, whether the coronavirus will attack or will unduly and more or less, whether there will be susceptibility in terms of Black, just as the color. So this is the point that I was coming, the standpoint that I was saying, that we cannot say race as in that. But of course, I quite agree with my colleagues that if you are talking about race as a composite factor, which includes the fact that certain people, because of their color, they are discriminated. The fact that even France is saying that they are quite shocked that African continent is not as affected as they thought. Also, it's a confirmation of the point that I'm making, that exists in people's conceptually, that, okay, on people's mind, they think that Blacks, just by being Black, may predispose you to this disease, but it's not. From purely biomedical point of view.
Okay, thank you so much, Dr. Fobil. And obviously, we were just starting really to enter into some very interesting spaces and of discussion. And but unfortunately, our time has run out. And so I want to thank the conveners of the panel. Lori Lambert and Ben Talton and Bryce Henson and Ana Lucia Araujo for organizing this discussion on COVID-19 and the African diaspora. And we're only getting started. So it's up to the conveners to determine whether or not we need to have a round 2 and possibly a round 3. I would be in favor of that, because we've only touched the surface, but we need to be respectful of everyone's time. So I think at this point, I've been instructed to end the panel, and I will be obedient and do that. So I want to thank everyone, all of the panelists, for their time, Dr. Brito and Edu and Fobil and Phillip-Dowe and Soumahoro. Thank you so much for your participation, and I do hope that we will have further opportunity to convene. Thank you very much.
Thank you.
Thank you.
Well, thank you
Thank
very
you.
much. Stay safe.